Medical researchers in Tampa Bay are in limbo, wondering if the National Institutes of Health will slash grant funding already approved by Congress. The White House says it's trying to cut overhead spending.
And across the Bay Area, the grants fund research into cures for cancer, for Alzheimer's. And as 10 Tampa Bay's Chris Hurst explains, they worry that work could stop.
Very, very shocking, very upsetting.
At the Roskamp Institute in Bradenton, scientists use NIH grants to study new treatments for brain injuries and measure the impact of red tide exposure on the brain.
Trying to understand exactly how the toxin distributes and how it works in the body.
It gets on average about $1 million a year from the NIH, a portion of which is for indirect costs like support staff.
The folks who are in the positions that are paid for from our indirect costs, they all do multiple things. There's absolutely no excess here.
Layoffs could happen if a reduction in the indirect reimbursement rate takes effect, which is currently blocked by a federal judge in Boston.
Waiting to see what happens next and just getting on with the science in the meantime.
Across Tampa Bay, institutions including the University of South Florida and Moffitt Cancer Center and Research Institute are slated to get more than $20 million in new grants this year alone.
This is taxpayer money. This isn't money that is fallen from the sky or fallen from a tree.
Republican State Senator Nick DiCeglie says the president and the White House understand these programs help Americans, but says shrinking the federal budget is a top priority.
I applaud the president for going down this road and taking an honest look at what's going on.
Grant recipients are sending invoices now to the feds for January's expenses. Those payments haven't been reduced for now. In St. Petersburg, Chris Hurst, 10 Tampa Bay.
The current NIH director says lowering the reimbursement rate for indirect costs is similar to what many leading nonprofit foundations pay. A hearing on the temporary order blocking the change is scheduled for Monday.